Most people don't find out their kidneys are failing until it's almost too late. And I don't say that to scare you. I say it because I've seen it happen too many times in the emergency room. A patient comes in, we run the labs, and their kidney function is already down to 30, 20, sometimes 15%. When I ask them if they noticed anything unusual, they say they were tired, their ankles were a little swollen, they thought it was nothing. That's the problem. The kidneys give you warnings. Real, physical, undeniable warnings. But because those warnings don't look like what people expect, they get ignored for months, sometimes years, until the damage cannot be reversed. I'm Dr. Zack Hayes, emergency medicine physician. I've seen what late-stage kidney disease does to a person, and I've also seen what happens when someone catches it early, makes the right changes, and genuinely turns things around. Those two outcomes are completely different, and the line between them is often just information, knowing what to look for, understanding what your body is actually telling you. If this kind of content matters to you, subscribe to this channel right now. I put out real, doctor-level health information designed to help you understand your body before something goes wrong. Hit subscribe. Let's get into this. Your kidneys are filtering about half a cup of blood every single minute right now. Every day they process roughly 200 liters of fluid, pulling out waste, toxins, excess salt, and metabolic byproducts. They regulate your blood pressure, help manage red blood cell production, activate vitamin D, and balance your body's entire internal chemistry. And they do all of this quietly, without complaint, until the damage is significant. By the time you feel something, you've often already lost a meaningful percentage of function. That's why these 9 signs matter so much. The first sign is changes in urination. Most people don't pay attention to this, and it's one of the earliest signals the kidneys send. Waking up multiple times at night to urinate is worth noticing. When kidneys lose their ability to concentrate urine during the day, they compensate at night. Increased urge to urinate with small output, or the opposite, urinating far less than usual, are both flags. But the most overlooked change is foamy or frothy urine. Persistent bubbles that don't disappear quickly often mean protein is leaking into the urine. Healthy kidneys keep protein in the bloodstream where it belongs. When the filtration system starts breaking down, protein slips through. Doctors call this proteinuria, and it shows up in a simple urine test. Tea-colored or brownish urine can indicate blood, which has causes ranging from kidney stones to inflammation of the filtration units. None of these changes should be attributed to dehydration and ignored. The second sign is swelling. When the kidneys can't regulate fluid and sodium balance properly, fluid accumulates where it shouldn't. The most common locations are the ankles, feet, and lower legs. Shoes feel tight by the end of the day. Socks leave deep marks around your ankles. Legs feel heavy and stiff. This edema tends to be persistent, affects both sides equally, and doesn't resolve easily overnight. Swelling can also appear in the hands and around the eyes. Persistent puffiness under the eyes in the morning, especially combined with foamy urine, is a combination that nephrologists take seriously. If you've been waking up with facial puffiness that doesn't clear quickly and doesn't respond to allergy medication, that combination warrants a kidney evaluation. The third sign is fatigue that doesn't improve with rest. The kidneys produce a hormone called erythropoietin, which signals the bone marrow to make red blood cells. When kidney function drops, erythropoietin drops with it. Fewer red blood cells means less oxygen reaching your muscles and brain. The result is anemia, and anemia means the kind of exhaustion that sleep doesn't fix. Simultaneously, waste products that healthy kidneys would clear start accumulating in the bloodstream. Even in early stages, this creates a heaviness and mental fog that is hard to shake. If you're waking up already tired, if climbing stairs feels disproportionately hard, if your energy has dropped without an obvious reason, don't normalize it. Sign 4 is the one most people completely miss, and it's the reason it's called out specifically in the title. Persistent itching with no visible rash. This is called uremic pruritus, and it happens when the kidneys fail to adequately clear phosphorus and other waste products from the blood. These accumulate and trigger nerve endings throughout the skin, creating a deep, diffuse itch that antihistamines don't touch and lotions don't resolve. It tends to be worse at night and is most common on the back, arms, and legs. Most people who experience this go to a dermatologist, try allergy pills, switch their laundry detergent, and never once think to get a kidney function test. It is medically well documented, it appears consistently in the clinical literature on chronic kidney disease, and it is routinely missed because neither the patient nor sometimes the physician connects the itch to the kidney. If you have unexplained persistent itching with no skin cause, ask your doctor for a kidney function panel and a phosphorus level specifically. If you're finding this helpful, this is a good moment to subscribe and share this video with someone you care about. Kidney disease silently affects millions of people who don't know what to look for. You now know more than most. Pass it on. Sign 5 is high blood pressure that is difficult to control. The relationship between kidneys and blood pressure runs in both directions. High blood pressure damages the small vessels inside the kidneys over time, but damaged kidneys also raise blood pressure through a hormone system called the renin-angiotensin-aldosterone system. When kidney function drops, this system becomes dysregulated, pressure rises further, causing more kidney damage. Each cycle makes the next one worse. If your blood pressure requires multiple medications to manage, or if it keeps rising despite good habits, ask your doctor whether your kidneys have been properly evaluated. A serum creatinine and a urine albumin to creatinine ratio are simple, inexpensive tests that can answer that question. Sign 6 is a persistent metallic or ammonia-like taste and unexplained changes in appetite. When the kidneys aren't clearing urea efficiently, bacteria in the mouth break it down into ammonia. The result is a metallic flavor, especially in the mornings, and breath that doesn't improve with brushing. Foods that used to be enjoyable start tasting wrong, and meat in particular often becomes unappealing. Many patients with undiagnosed kidney disease unconsciously reduce their food intake months before they know anything is wrong because eating just doesn't feel rewarding anymore. Combined appetite loss and taste changes that have no obvious explanation are worth investigating with a kidney panel. Sign 7 is nighttime muscle cramps. The kidneys maintain precise balances of calcium, potassium, phosphorus, and sodium. When those balances are disrupted by declining kidney function, muscles become irritable. The most common result is severe cramping in the calves or feet that wakes you from sleep. While leg cramps have many causes, cramps that are frequent and severe, especially alongside any other signs on this list, should prompt a kidney evaluation. Low calcium levels, which the kidneys help regulate by activating vitamin D, cause significant muscle irritability and are among the earliest chemical changes seen in declining kidney function. Sign 8 is shortness of breath that doesn't match your exertion level. The kidneys connect to your breathing in two ways. First, anemia from reduced erythropoietin means your blood carries less oxygen, so your body compensates by breathing faster with less effort, leaving you feeling winded doing things that used to feel easy. Second, when the kidneys fail to remove excess fluid, that fluid can accumulate in the lungs. This causes a persistent feeling of breathlessness, difficulty lying completely flat, and a sense of chest heaviness, particularly at rest or at night. If you've recently started needing an extra pillow to breathe comfortably while sleeping, or if you're getting out of breath in ways that feel new and unexplained, those symptoms are serious enough to warrant prompt medical attention. Sign 9 is brain fog and mental slowing. The brain is highly sensitive to changes in blood chemistry. When uremic toxins accumulate and electrolyte balances shift, the brain's environment becomes disrupted. Patients describe thinking through fog, losing the thread of conversations, struggling to recall words, and feeling mentally slower than their baseline. Because this develops gradually, most people attribute it to aging, stress, or poor sleep. But in the context of kidney disease, it is metabolic in origin, and it is reversible when kidney function is supported and treated. Combine this with persistent fatigue and any of the other signs, and it becomes a pattern worth investigating. Now here's what this means for you practically. If you recognize 2, 3, or 4 of these signs in yourself, that is not a reason to panic. It is a reason to call your doctor and ask for a kidney function evaluation. A basic metabolic panel gives you serum creatinine and electrolytes. A urine test shows protein levels. Your doctor can calculate your estimated GFR, glomerular filtration rate, which is the most direct measure of how well your kidneys are actually filtering. If it's normal, you move forward with peace of mind. If it's not, you now have the chance to act while something can still be done. Know your risk factors. Diabetes is the leading cause of chronic kidney disease, responsible for nearly 40% of cases. High blood pressure is second. If you have either condition, your kidneys need to be monitored every year, regardless of symptoms. Other significant risks include frequent use of ibuprofen or naproxen, obesity, smoking, a family history of kidney disease, and a history of recurrent urinary tract infections. Be honest about your NSAID use. Over-the-counter pain medications like ibuprofen and naproxen reduce blood flow to the kidneys and damage filtration structures when used regularly. Occasional use is generally fine. Daily or near-daily use for chronic pain is genuinely harmful to your kidneys over time. If that describes you, talk to your doctor about safer alternatives for managing your pain long-term. Stay hydrated consistently. Chronic mild dehydration, the kind most adults live with without realizing it, quietly stresses the kidneys year after year. You don't need extreme water intake. But if your urine is consistently dark yellow, make a conscious effort to drink more water and monitor the difference. And stop waiting for symptoms to feel severe before you act. This is the most important practical message in this video. The kidneys are forgiving in the sense that you can live with significantly reduced function for years, but that is not a reason to delay. Every year of uncontrolled blood pressure, unmanaged diabetes, or ongoing nephrotoxic medication use is a year of functional capacity that doesn't come back. Kidney tissue, once scarred, does not regenerate. The goal is not to treat kidney disease after it is established. The goal is to catch the decline before the damage becomes permanent. I've had patients who came in at stage 3 kidney disease, made the necessary changes, and stayed there for decades, living full, healthy lives. And I've had patients who ignored the signals for years and were facing dialysis within months. The biology wasn't that different. The information they had, and when they chose to act on it, made all the difference. Here's what I want you to carry with you after this video. Your kidneys will not send you a loud, unmistakable alarm. They will whisper. Changes in urine, puffiness around your eyes, an unexplained itch, fatigue that sleep doesn't fix, metallic taste, cramps at night, breathlessness that doesn't add up. These are the whispers. Most people don't hear them. You now know what to listen for. Subscribe to this channel if this gave you something real. I make videos designed to give you clear, medically grounded information that helps you make better decisions for your health. No fear tactics, no oversimplification, just the real information explained properly. Subscribe and leave a comment below telling me which of these 9 signs surprised you most. I read every one of them, and they help me understand what to cover next. Your kidneys have been working for you every minute of your life. Pay attention when they ask for help.